92 million Americans live in an area where there are not enough doctors, nurses, or providers to meet the population's needs. The federal government has a name for these places: health professional shortage areas. But a simpler name describes them better: health deserts. A primary care shortage area is designated when the patient-to-provider ratio exceeds 3,500 to 1. The national average for a functioning practice is 1,500 patients per provider. In the most underserved areas, one nurse practitioner or physician assistant is covering an entire county. Health professional shortage areas exist across three categories. Primary care, more than 7,500 designated areas, affecting 92 million Americans. Mental health, more than 6,500 shortage areas, affecting 158 million. Dental care, more than 7,000 shortage areas, affecting 65 million. Rural communities are disproportionately represented in all three. These health shortage areas are not randomly distributed. They cluster in predictable places: rural communities, tribal lands, low-income urban neighborhoods, and communities of color. More than 180 rural hospitals have closed since 2005. Agricultural communities with high immigrant populations face language access barriers on top of provider shortages. When APRN training becomes harder to fund, when PA programs lose students to financial barriers, the communities that depend on these providers bear the direct clinical cost. Emergency rooms become primary care. Preventable conditions become hospitalizations. Maternal mortality, already a crisis in the United States, gets worse in the places where it is already worst. Decades of research have reached a consistent finding. Providers who grew up in underserved communities are significantly more likely to return to practice in them. Medical students from rural backgrounds practice in rural areas. Students from low-income urban backgrounds work in safety net settings. Bilingual providers practice in bilingual communities. If the goal is to get providers into health deserts, the most reliable predictor is where those providers came from. Investing in students from these communities is not charity. It is infrastructure repair. If this is your story, if you come from a community like this and want to go back to serve it, the Daisy Family Foundation was built for you. Link in the description.